Thanks for tuning in to Conversations with Betty LaMarr, coming to you live from the Bluff City. Conversations is weekly wall-to-wall talk about all things Memphis and the Mid-South. Conversations with Betty include people just like you, living on the Bluff, doing what you do to uplift the city of Memphis.
Hello again and welcome to Let's Talk 901. I am your host, Betty LaMarr. We have a very interesting conversation today, and I am so excited about my guest today. We're talking about firearm injury. What do I say? We all watch the news, and it seems like we're inundated with gun violence in 901, and I think throughout the United States. So to help me tackle this today is Dr. Derek Kelly. Dr. Kelly, welcome to Let's Talk 901.
Thank you for having me. I appreciate the opportunity.
I thank you for being here because this is so very important. Before we kick this off, let's talk about who you are, what you do, and where you do it.
All right. Well, my name is Derek Kelly. I'm a pediatric orthopedic surgeon. I work at Campbell Clinic and LeBonheur Children's Hospital. I'm a professor of orthopedics for the University of Tennessee, and we provide education to the residents and the medical students through UT Medical School as well.
Okay, now, the study about firearm injuries. How did this get started? You know, how did we get here?
Well, so there's a number of different things you'll need to understand to know where the study came from. LeBonheur Children's Hospital is a level 1 trauma center. You know that they do all kinds of great work caring for children in the Mid-South and the region. And so they collect data on all of their trauma patients that come in, whether it be car wrecks or playground injuries or whatever it might be. Well, over the last 15 years, we have noticed as part of the trauma group an increase in the number of firearm injuries that we were seeing. And it was not hard to miss it. It just steadily was increasing. And then about 4 years ago, the CDC came out with their statistics on national firearm injuries. And for the 4th year running, firearms have been the leading cause of death in children in the United States. So the combination of the CDC's nationwide data and our own database got us interested in looking at our own data. And we were able to find over a 10-year period over 1,100 children who were injured by firearms that just came to LeBonheur alone.
Okay, well, you're exactly right about LeBonheur because actually I worked at LeBonheur. And I worked in dispatch for a while and in security for a while. I like to move around and do things different. And I always noticed it seemed like most of the injuries, because they were called dispatch, so we'll alert security was coming. And it seemed like we used to call it GSW, gunshot. So it seemed like they was always coming out of the black community. And I would always say that most of the white kids that were coming in, they was on those ATVs or whatever you call those things, rollovers. And so let's go there a little bit.
Sure.
Why do you think gunshots is so prevalent, period, in the black community? I know you have something on your study about disparity.
Yes.
How does that come into play?
So, well, one of the reasons we see more black children injured in the Memphis area is because Memphis is predominantly a black community.
Yeah.
So just because of the nature of our demographics, we're going to see higher numbers.
Okay.
I was interested into the disparities in the demographics of our data. We started looking very detailed. It's not only the black inner city in Memphis where we're seeing this. We're seeing it all over. We're seeing it from the suburbs. We're seeing it from the rural communities as well. So we are having white kids, Hispanic kids coming into the hospital with firearm injuries. There are many different causes. Although the black kids seem to be getting shot more, we're seeing it across the region. And we're also seeing assaults. We're seeing accidents. So children finding guns in the home and using them accidentally on themselves or others. Or we're seeing kids from the suburbs and from the rural areas taking firearms and using them for assaults. So we're seeing it across the region. But to your point, our data did show that the black kids and handguns and assaults were our most common sources of injuries in this 1,100 patient study.
You know, Dr. Kelly, when I look at the local news, sometimes you have to, right? You just want to see what's going on and what's coming at you. And I noticed the guys, when they're shooting, you know, they always capture it. And the way they, you know, shoot people. And being a veteran myself, you know, just in basic training, you don't even get out of basic training unless you know how to fire that firearm and fire it safely. They just don't let you go out there and just start shooting because you could shoot your fellow soldier, right? So it's like they have access to guns, but it's obvious to me, being trained on firearms, that this is not how you aim and shoot. Therefore, innocent people get shot. And another thing, how is it low information, or for what reason does parents or whomever that have guns, obviously the babies are not buying the guns.
Of course.
So is it low information, or because the VA give us gun locks?
Of course.
You know, they'll ask you, do you have a gun at home? Yes. Here's a gun lock, right? So do they not understand? Do they not listen?
They don't understand in many cases. This is my theory. This is not part of this particular
Right.
research study. This is my theory that they don't understand. But they're not required to understand.
Okay.
There are not requirements for training. There are not requirements for ongoing safety training that when you own a firearm. Now, you do have the requirement to sell a gun lock when you sell the gun, but there's no requirements to use it, and there's no requirements to understand these things, how to be safe with a gun. You're in the military, you had firearm safety training, but most people who own guns in this part of the world, in the United States, they don't have that training, which is very, very unfortunate. And I would think it probably leads to a lot of this. Now, again, that is my own personal perspective. That doesn't come from our data, but it just certainly seems like there are a lot of unsecured guns being used in unsafe ways by people who are not responsible owners.
Yes. So how, I know it's devastating when a child comes in, well, anybody, but right now we're just talking about, pediatric, when they come in with gunshot wounds, how devastating is it?
Well, it can be from very simple. We can have very simple injuries through and through, soft tissue to an arm or a leg. Doesn't cause much damage. Fortunately, we see those, which means that the patient is likely going to do very well. They're going to have some pain, they're going to have some scarring, going to have some bruising, but likely they're going to function normally. But we have very devastating injuries. In our study, less than 5% of the kids actually died from their gunshot wounds. So most of these children are surviving their injuries, and some of these injuries are very devastating. Kids can lose parts of arms, parts of legs. They can have injuries to the head, neck, thorax, abdomen that can be really challenging for these kids. And that's just the body part of it. That's the physical part. That doesn't really get to the psychological aspects of these injuries, which can be very, very challenging for the children and for their families.
Yes. So are you, when the patient comes in, when there's a GSW, as we call it, our little call signal, GSW, en route, 10 minutes. So are you already there, or do they call you up?
Yeah.
Exactly what do you do in relation to the actual patient and the wound?
So my specific job, I'm a pediatric orthopedic surgeon. So I deal with bones, joints, arms, legs, and spines in the kids. So if the bullet impacts part of those tissues, then I will likely be called. But we have a whole team there. I mean, there's a huge team at LaMarr that takes care of these things. Unfortunately, we have gotten very good at it because we see so many of them. So when the kids come in, they are immediately part of our trauma workup. They go straight into our trauma system, and they get the best care we can provide.
Okay. We'll be right back with more with Dr. Derek M. Kelly.
This is Dr. Chinelo Animalo, the host of Medical Class 901 with Dr. Chi, and this is the show that talks about the major infections that plague us here in our Memphis community. So please make sure you tune in every Sunday at 6:30 to get a glimpse of this class. See you then.
Welcome back to Let's Talk 901. I'm your host, Betty LaMarr. Okay, so today we're talking about firearm injuries. My very special guest is Dr. Derek Kelly, and I'm going to pitch it over to him because when we left, we was just getting into the injuries and some of the things that happen after a gunshot wound. Okay, Dr. Kelly, now I'm depending on you now to take this on. Now let's talk about some of the, I guess you would say, the aftermath of what happens after a person has a gunshot wound.
Yeah, so this is where we're taking our current research.
Okay.
As we discussed before, we've had a large study with over 1,100 patients, which is a huge number in just from one hospital. But now we're starting to parse that out and look at individual ages or individual parts of the body that were injured and kind of learn a little bit more about what these children face long term. They can run into lots of problems. Now, I'm an orthopedic surgeon, so I deal with the skeleton of these children.
Okay.
And as we know, children start off small and they become larger adults, so there's a process of growth. And these bones grow through areas called growth plates. And almost all of the bones in our body have areas that allow the bone to grow larger. We have seen many of these bullets will enter into the body of these children and impact some of those growth centers. And so we're very interested in what are the long-term growth effects of some of these devastating injuries. So we currently have a study we're starting to do to look at that. We don't have our results yet. But we have noticed, at least in preliminary results, that many of these growth plates no longer function normally, and this can lead to lifelong deformities.
Okay, and sometime, like, when you're out and about, especially in Midtown for some reason, each time I see a young man in a wheelchair and look like they're an amputee. Yes.
The amputation rate is very, very low. Some of these injuries can be very devastating, and in very rare cases, they have led to amputations of part of the arm or part of the leg.
Okay.
It's uncommon that a firearm injury will lead to that. If we took all amputations across the country, across our region, I would say that firearms are going to be a fairly low cause of amputation, particularly in children, but certainly it does happen.
Okay.
But if you don't mind, that leads me to another area that we're looking at. We're also looking at the complexity of these wounds in kids. Kids are much smaller than adults, so a simple 9mm round or a .22 round that goes into the body of an adult, it'll cause a large amount of damage. But if that same round goes into the small body of a child, we're trying to determine if these wounds are the same complexity as we see in adults. The theory is that perhaps these wounds are a little more challenging to treat because they create such a larger area of devastation in such a small body. We're still starting to look at those results, but we don't quite have our studies completed yet.
Okay. So let's talk about, what does lead poisoning have to do with the gunshot wound?
This is a very interesting one that we've just started to learn about. I'm working with a Pediatric Orthopaedic research group. This is a consortium of centers across the United States where we're trying to come together and look at all of our data. And we've just recently started looking at lead poisoning. So not every ballistic round that goes into a firearm or comes out of a firearm contains lead, but many of them do. And if lead ends up in the body of a person, it can lead to toxic levels that can cause all sorts of systemic issues. It's much more troublesome in children.
Yeah.
If we think back decades ago with homes that had lead paint, many of these children had challenges with mental function or with the growth of their body because of their lead poisoning. Well, now we're starting to look at some of these kids who have indwelling bullet fragments that cannot be removed easily. And we're starting to see some of those children have increasing lead. So we're just now on the front edge of starting to understand a little bit more about what lead poisoning may mean for these kids long term.
So, but I never associated lead and getting, I never even heard it mentioned before. That's why this study really is so very good. Now let's talk about, we talked about the young black men, young black boys that deal with. Let's talk about assault weapons. I really want to talk about that because I know they have to do some devastation to the body, if you will. So let's talk about that.
Yeah, of course. So we did look at that in our study.
Okay.
We looked at the type of firearm, if we knew what it was. And in many cases, in cases of assault, you don't really know because people are not telling you, or they have no idea because the bullet came out of somewhere and they never know where it came from or who fired it. So the most common type of weapon by far in our study was handguns. Handguns are really the cause. Rifle injuries, shotgun injuries, specifically assault rifle injuries, were extremely rare in this patient study, only accounting for just a couple of patients. So the big problem is handguns. Not that we shouldn't consider assault weapons and the challenges they pose to society, whether for good or bad, in most cases bad. We really are taking the focus away from the real problem. The real problem is handguns. That's where the bullets are coming from, and that's how these people are being harmed.
Yeah, I could never understand why it's, okay, I'm just speaking personally, why it's okay for young people, period, to have access to guns when they haven't been going back to train, they haven't had any training, and then like we're going to the psychological distress, and there are so many young people that are, because of distress, and it's almost like, I always use the expression, Dr. Kelly, they live almost a life of hopeless. They just feel like hopeless because like life don't mean anything to them, right? Or another person's life doesn't mean anything. And that's, when I see gun violence, that's the first thing I think about is how can you just shoot someone, period. That's a life. And just to shoot it randomly is even worse because you don't know who you're shooting. So, I mean, I know this is not a part of the study, but this is just a heart thing for me. Does anyone ever ask people, like, what was it all about? Do they know what it was all about, or did they just get shot?
Yes, right. So yes, the answer is yes. In many cases, in most cases, we do. You mentioned the psychological aspects of these injuries, and we definitely look at this very closely in the kids that come to our hospital. We have a whole team that focus on the psychological aspects of these children, and that continues after they leave the hospital into their follow-up. When you talk about these injuries, in most cases, the person that I am seeing in the hospital and that my colleagues are seeing in the hospital is not the person who fired the gun. Occasionally it is. Occasionally the kid fires the gun, it goes off, and they shoot themselves. Most of the time, the child is the victim from violence that came from outside of them, and we really don't understand the psychology of the people that are firing these weapons.
Okay. We'll be right back with my very special guest, Dr. Derek Kelly, and we're going to talk a little bit more about the psychological devastation of a person being injured due to gun violence. We'll be right back.
This is Dr. Chinelo Animalo, the host of Medical Class 901 with Dr. Chi, and this is the show that talks about the major infections that plague us here in our Memphis community. So please make sure you tune in every Sunday at 6:30 to get a glimpse of this class. See you then.
Welcome back. This is Let's Talk 901. I'm your host, Betty LaMarr. Joining me today in this wonderful conversation, not a wonderful thing that we're talking about, but it's a wonderful conversation that I'm having with Dr. Derek Kelly. We're talking about firearm injury. You know, we all call it gunshot, gun violence. So we have an expert with us today, and he's going to take us out in this last segment, and he's going to go over all the things that we need to know about the study related to firearm injuries, okay? All right, so Dr. Kelly, I'm going to turn it over to you because, like the viewers, I want to learn something today.
All right, so as we were discussing before, just to summarize,
Okay.
the study that kind of brought our conversation together was a study that came from LeBonner Children's Hospital, and we looked at over 1,100 gunshot wounds in children over the course of about 10 years, which is a very large number for a single hospital. And we looked at all different aspects: who was getting injured, how old were they, what were the types of weapons being used, and how were the weapons being used. We found that black patients were much more common. Now that is somewhat to do with the demographic of the city, but certainly that was a concern. Adolescents were more common, handguns were more common, and assaults were more common. So if we were going to look as policymakers, which I'm not, I'm a surgeon, but if we were going to look at it from a legislative or a law enforcement standpoint, the things we really need to focus on are handguns and assaults in the adolescent population. Now certainly we saw suicides, we saw accidents, we saw rifles and shotguns, but those were much less common. We saw very young kids as well, but for the most part, this is a young adolescent handgun and assault situation that we need to work on. Now, we mentioned going into that last break, we're starting to look a little bit more into the psychology of these injuries. Those are going to be some directions for future study through LeBonner and through their psychology team about looking at what are the long-term implications of the psychological impact. My main concern is the physical of these children, especially long-term related to the growth of their bodies and how that we can get their function back, how we can get their arms and legs working again after they're devastated by these weapons. We've started to break some of this data out, and we're starting to look at certain regions of the body. In fact, I just reviewed some preliminary data today. We're going to look at what happens to the arm between the shoulder and the elbow when it's injured. There are many nerves that run in this area. We want to learn a little bit more about the frequency of nerve injuries and the frequency that the children have problems with their growth. And over time, we're going to start looking at different regions of the body to understand how we can treat these injuries better. So those are the future directions for our research.
Okay.
Now,
So let's, you mentioned nerve, because I actually had what you call this nerve, where you go to the hospital and they do this procedure to check your nerve. Where
check your nerve function? Yep.
Yes, I
That's
just
right.
went through that, right?
Yep.
So you never think about that. Normally when a person say, someone got shot and where, you always ask where? In the arm. And then you automatically think, oh, that's no big deal then, right? But what I'm hearing is Yes, it can be a big deal.
Well, that's what we're learning. We want to know how much of a big deal could it potentially be. As we mentioned earlier, maybe a segment or so ago, sometimes these injuries are very minor. A simple scratch, simple through and through bullet hole to the soft tissues, and the patient suffers really no major long-term complications, at least from a physical standpoint. But some of these injuries can be extremely devastating. They destroy the bone, they destroy the joint, they destroy the nerves, and those patients can have lifelong dysfunction. And even in such rare cases, they can destroy the blood vessels, which could lead to loss of a limb. If you destroy a major artery that cannot be repaired, then you may lose a limb. So we're looking at all of those things in this study. Fortunately, the amputations and the long-term neurological injuries are much, much less common. So what happens next?
Yes.
What do we do?
Yes.
So we've started looking at the data since this study came out. And this study came out about 2 years ago, and it was from data that went back 10 years prior to that. Over the last couple of years, fortunately, we're starting to see a slight decline in our numbers. So it looked like our peak. Hopefully, we will never see numbers as high as we saw in 2022 and 2023. We're starting to see those numbers going down slightly.
Good.
They're still much too high. We're still seeing over 150 kids per year coming to the Children's Hospital with gunshot wounds. But it's at least maybe trending down.
That's down?
It's down. That is down. Now, and my hope and our team's hope is that we have seen the top. We've seen the peak, and now we're going to start to see the decline. The reasons for that, we don't really know. There have been a lot of community intervention programs through advocacy organizations, through law enforcement, through county and city programs, and perhaps those are beginning to have an impact. Perhaps people are starting to educate themselves more. I hope that people are starting to be safer with their firearms. If you have them in the home, they need to be locked up. They need to be locked up safely. The thought that you're going to have a firearm readily available and someone's going to come into your home and you're going to be able to defend your home with that firearm is most likely a myth. Yes, it certainly does happen, but the most common thing when you have a firearm in your home is that it's going to be used in a way that you did not intend, to be used on you or someone you know and love. If the gun is in the home, it needs to be locked up, safe, and away from the ammunition. They need to be separate and both need to be secured and locked. That's probably the first thing that we can do to be responsible with firearms in this country in order to hopefully start to decrease some of these numbers further.
Yeah, and that's, I love that. I love how you put that because it was just like so spot on because you're right. Most people think, well, if I lock my gun, then what if somebody come in and I don't have time to get it ready, set, go, right?
That's right.
So how can you convince someone that have that mindset that it can be locked and you can get to it?
I don't know
if you
that
have children in the house, it should be worth it for you not to worry about that, but to keep the child from getting it, because it's a toy to them.
I don't know that I can tell somebody if you wake up at 3 o'clock in the morning with someone breaking windows that you're going to have time to get to a locked gun and use it. Now, there are certain ways that can be done. There's the biometric safes that are fingerprint activated or simple code activated that you could have a loaded gun ready to go in your home and get to it quickly. But those are very expensive options.
Yes.
So if you don't have access to those types of things, then you have to just understand the data. The data is that firearms are more likely to cause harm to the owners or someone they love than it is to an intruder. Now, you have to determine for your own self if you're willing to take that risk. But if you have an unsecured loaded gun in your home, it's much more likely to harm you or somebody you love than it is to harm an intruder.
Okay.
So people just have to be aware of that. And then they have to understand what risks they take when they have an unsecured gun in their home.
But what's wrong with just putting it out of, you have children or young people in the home, what's wrong with just putting it away where you can get it, but a 2-year-old kid can't get it?
So the data shows that a hidden gun is not a secured gun.
Okay.
Kids are very clever. If you think there's something in your home that's hidden, it isn't.
Okay.
Now, from a 2-year-old, probably so. But 5, 6, 7, 8-year-old kids, you do not have anything hidden in your home.
Okay.
They're going to get around and they're going to find the things.
In other words, lock it up, right?
Lock it up.
Okay, now, since this will be continued a little later, let's talk about the Memphis Business Journal 2025 Heroes Award. Of course, I was there. So happy to see you receive that award. Let's talk about that. Were you surprised?
I was very surprised. The reason I was surprised is because I knew the other people that were in the same category as me, and I know some of them very well, and they do phenomenal, amazing work. I even joked to my wife, she was at the banquet as well on the way there, I said, we're going to go and have a nice dinner,
Yes.
but I can tell you there's no way that I'm going to be getting this award because of all the wonderful things. And really, any of the 5 people in that category, and the 25 in the room, deserve these awards because there's some
Yes.
phenomenal work. I was amazed listening to all the things that people are doing in this community.
So do you know how that process works? I know they have judges, right?
Mm-hmm.
And they look at everyone's credentials and what you do. Like in Dr. Animalo's, she was a community outreach.
That's right.
So I guess maybe they look at what you do and stack it up against all the other people? Because you was in a category with a lot of people.
I think you probably know about as much about this as I do. I think the nominations can come from lots of different places, and you can be nominated into different categories. The category I was in was healthcare provider, physician.
Okay.
There was a healthcare provider, non-physician, which would be allowed, nurses and other types of healthcare professionals. There was the outreach that you talked about, people doing a lot of community outreach work.
Yes.
There was an administrator category. So my understanding is that you can be nominated by anyone, I suppose.
Wow.
And then they nominate you for a specific category. The judging process, I was blind to that. I didn't know, but I think they looked at your body of work, your resume, your CV, and they just determined what they thought was probably the most impactful for that particular year.
Yeah, it just happened to be your time.
It was just really wonderful.
You
Yes.
deserved it. After that study, like I said, even though, to be honest, other than just wanting to talk about this, it's like, I know you need another professional with him because this is too good. Because when you delve into that, if the judges were actually even entertaining that study that you all did together, I said that was worth him being on stage right there. I sort of feel like things happen in life for a reason. I've always believed that. But anyway, we have, I would say, had a wonderful conversation, and I learned a lot having you here. And I really do appreciate you. Just the fact that you are so passionate about what you do for people that are injured. I do look forward to you coming in and you guys really delving into it and to really give us the information that we need to know about it, because I know there's so much more.
Well, I would love the
have to
opportunity to
share.
do that, and perhaps we can, in the coming weeks or months, perhaps we can get the chance to visit
Yes.
again and maybe bring some others on who are passionate about this as well.
That'll be great. I would just like to sit back, direct the show, and learn something. How about that?
Wonderful. Yeah.
Okay, I'm going to let you take us out, and if you will, for the viewers that may want to know again who you are and what you do, and your website or anything that you may want to give the viewers on the way out. And thank you so much, Dr. Kelly. It really means a lot having you here with me today.
Well, thank you so much.
Thank you.
Well, my name is Derek Kelly. I'm a pediatric orthopedic surgeon. I work at the Campbell Clinic and the Bonner Children's Hospital. Simple Google search can help you find places where I advocate. I'm also on Instagram, Dr. Kelly Kid Bones, where I talk about lots of different aspects of pediatric orthopedic care, but also gunshot injuries. And I just want to ask the viewers, if you have guns, please secure them. Lock them up, make sure they're safe, make sure they can't be taken by someone you know or love or by someone who breaks into your home or breaks into your car. Please lock up your weapons so they are not used in a way that you do not intend. Thank you so much for this opportunity.
Thank
I
you
really
too.
appreciate it.
I appreciate it too. Thank you, Dr. Kelly.